So despite recording a decline in infections, the Ashanti region has seen its COVID-19 case of fatalities shoot up in the last 3 weeks with 47 new deaths. The number of deaths continued to be on the rise, increasing from 297 in July to 344 cumulative deaths as at August 16, 2021. The Regional Health Director, Dr. Emmanuel Kojo-Tenkran, told a weekly COVID-19 media briefing the situation should warn the public to be wary of the dangers of COVID-19, especially in adhering to the safety protocols. Ohiminteri of our health desk has more in the following report.
The Ashanti region has seen its daily COVID-19 infections drop from 873 in July 25 to 392 in August 15, 2021. But despite the decline, the region has seen an upsurge in fatalities with 47 deaths recorded in the last 3 weeks. Among the new deaths is a health worker who failed to be vaccinated. Ashanti Regional Director of Health, Dr. Emmanuel Kojo-Tenkran says, though none of those killed was vaccinated, the death toll tells of the reality of COVID-19.
COVID kills. And a lot of people, because they are not seeing the deaths in their homes, they think that the COVID can kill. But the situation in our hospitals is quite different from what those in public are seeing. When you come to our hospitals, we get cases of COVID all the time. And unfortunately, we lose some of them. And those we've lost are those that have not been vaccinated, unfortunately. And from the data that you presented yourself, as at the second wave, our death was 299 or 96. Now we've shot up to 344. It means that COVID kills. So that's the situation. And that is the message.
The upsurge comes as health authorities in the region receive 50,400 doses of the Johnson & Johnson vaccines. 4 COVID-19 hotspot districts are taking part in the exercise, which has seen 11,000 people vaccinated as at August 15, 2021. Dr. Tenkran is encouraging residents in affected districts to take advantage of the exercise in 36 designated centers as health authorities strengthen contact tracing and testing.
If you are not vaccinated, you don't adhere to the protocols, and you get COVID-19, it can kill you. We are doing more testing, we are doing more contact tracing, and that's the reason why we are getting the cases. In fact, if you are not testing and you are not doing contact tracing, you won't get any case. Previously, when it started, we were doing what we call the enhanced contact tracing. When we get a case, we just look at a certain radius and then go there and then test all the people there. What we are doing now is that when we get a case, we look at the contacts, the immediate contacts, and also test them. And from the second wave, that is what we've been doing throughout.
There is an ongoing public sensitization campaign for persons who received the first jab of AstraZeneca vaccine to stay away from the Johnson & Johnson vaccines. But some people continue to patronize the centers with the hope of being vaccinated. Dr. Tenkran warns the practice stopped.
We've had that report. Those who had the first dose of AstraZeneca are very anxious to get the second dose because they believe that the immunity will wane and that it will put them in a very big threat. But what we want to assure them from science is that when you take the AstraZeneca vaccine, at least when you wait for a period of about 6 months, even your immune system, when you get the second dose, is even better. What we can assure them is that the second dose will definitely come. They will have it. So they should wait.
From Kumasi, for Joy News, Ohiminteri reporting.